I place a lot of Sculptra in the periorbital area, and it makes my eyelids turn out so much better. And it makes some people not need eyelid surgery as soon if you can restore some of that baby fat loss. Baby fat loss throughout the face is inevitable. It happens in everybody, especially if you maintain your lean body mass. Sculptra is a volume restorer. I have a separate YouTube video that you can watch that goes into a lot of the specifics about Sculptra, but pertaining specifically to eyelid surgery, you might Google Sculptra and hear something like it. You cannot inject it around the eyes. Simply not true. Now, technically, the FDA, when they cleared Sculptra for facial rejuvenation, put in some fine print on the legal document that comes with any pharmaceutical that says very specifically the safety and efficacy of periorbital injection has not been established. And what the inside story on that really not a lot of people know is that every filler, no matter where it's injected, no matter who's injected, has the possibility of forming bumps. If you have a bump on your lip or on your nasolabial fold, that's not good. But if you have a bump in the lower eyelid, that's really not good, because we see our eyelids when we look in the mirror and adjust our rearview mirror, and it's just such a conspicuous area. And more now, physicians are delving into the last frontier of the face and putting fillers around there, and you can get great results. But in order to get great results, there's like a no tolerance and there's no room for error when you're restoring periorbital volume. You have to be meticulous, careful, patient, artistic, diligent, and somebody who can get away with treating nasolabial folds isn't necessarily qualified. And the reality is that I inject Sculptra around the eyes more than anywhere else. That's okay with the FDA and my malpractice premiums and the medical board. And the reason I injected there is because it works really good. And while when I was doing fat grafting around the eyes, I had 2 or 3 out of 100 patients who would have stubborn bumps. Now I have 1 or 2 out of hundreds and hundreds of Sculptra patients that will have a small bump, and the most common bumps are not visible. I'm the only one that can find them. I can't even convince the patient that they're there, like 1/3 of a grain of uncooked white rice. And they go away with time, with massage. They don't show, they're asymptomatic. Once or twice a year, I'll get a patient that will require 1 or 2 little cortisone injections to resolve a bump that's maybe a little bit visible on an angle, tangential lighting or something like that. But it's always easy to control if the patient will work with me, to eliminate if the patient will work with me.